Ivacaftor E, a G551D homozygote with cystic fibrosis. Definition: Ivacaftor in patients with cystic fibrosis who are heterozygous for the G551D mutation. The possibility of an increment response in persons who are homozygous for the mutation is uncommon because of its low prevalence. Ivacaftor potentiates the open child probability of the G551D cystic fibrosis transmembrane conductase regulator protein. The most common cystic fibrosis mutation, F508, the result in little or not CFTR reaching the cell surface, where which the G551D CFTR mutation.
Hello, my name is Dominic Purcell. You may recognize me from a TV show called Prison Break. I'm here today to discuss a subject that matters a great deal to me, cystic fibrosis. Now, cystic fibrosis has claimed the lives of millions throughout the world, including 3 family members, and now my young cousin Charlie also has it. Now, I'd like to read you something. A new wonder drug is available in the States called Deco. Just take 2 tablets a day, and this would allow Charlie and others with cystic fibrosis a future we all take for granted. Unfortunately, due to the high perceived costs, this medication may struggle to become available to all who need it in the UK and Ireland. We need your help. Please back this campaign to get this drug to Charlie and everyone else with cystic fibrosis. Go to Facebook, Quest for Deco. Like the page to show your support and see what everyone can do to help. Thank you.
Application in medicine. Therefore, they postulate an increment efficacy of Ivacaftor in G551D homozygote as compared with compound heterozygote with a single G551D mutation. Furthermore, little is known about the response to Ivacaftor in persons with a forced expiratory volume in 1 second of less than 30% of the predicate value, because that person were excluded for initial studies.
Kalydeco will benefit the CF patients with the mutation G551D. They will experience a decrease in cough. It'll be easier to breathe as demonstrated by improved lung function. They'll have fewer infections resulting in antibiotics, and they'll gain weight.
In lung airways and passages in other organs, cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted. because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface, but fail to open correctly. Kalydeco is designed to keep CFTR protein channels at the cell surface open longer, to improve the transport of salt and water across the cell membrane. Indication and important safety information. Kalydeco is a prescription medicine used for the treatment of cystic fibrosis, or CF, in patients aged 6 years and older who have a certain mutation in their CF gene called the G551D mutation. Kalydeco is not for use in people with CF due to other mutations in the CF gene. It is not effective in CF patients with 2 copies of the F508del mutation in the CF gene. It is not known if Kalydeco is safe and effective in children under 6 years of age. Kalydeco should not be used with certain medicines, including the antibiotics rifampin and rifabutin, seizure medications, phenobarbital, carbamazepine, or phenytoin, and the herbal supplement St. John's wort. Kalydeco can cause serious side effects. High liver enzymes in the blood have occurred in patients taking Kalydeco. Regular assessment is recommended. The most common side effects associated with Kalydeco include headache, upper respiratory tract infection or common cold, including sore throat, nasal or sinus congestion, and runny nose, stomach or abdominal pain, diarrhea, rash, nausea, and dizziness. These are not all the possible side effects of Kalydeco. Patients should tell their healthcare providers about any side effect that bothers them or doesn't go away. Please see full prescribing information for Kalydeco at www.kalydeco.com.
Pros and cons. We report the use of Ivacaftor in a 19 years old woman who has homozygote for the G551D mutation after a period of progressive deteriorations with recurring infecting exacerbations. The bacilli FEV1 have decreased to 24% of the predicted value. She has become dependent of the oxygen, and she was referred for assessment for lung transplantation.
What was exciting about this was that this really helped us understand that we've cracked the code to cystic fibrosis.
Issued applied in Ecuador. The improvements in sweet chloride levels and the FEV1 reached a plateau after 2 weeks to take. We have not found a plateau effect with Ivacaftor therapy in ours G551D homozygous patients. The progressive reduction and normalizations of the sweet chloride level coupled with the continued clinical improvements in lung function, weight, and walk distance troubles. The 12-month follow-up period providing support the incremental efficacy of the Ivacaftor in homozygous versus heterozygous patients.